Awesome. Do you mind if I have another spot? Yeah? I'll just get the show started. I'll get the show started and give you a shout. Hey, get the show started. Right on. Here we go. Awesome. Yes, welcome back. Yes, welcome back to another Live Lifts. My name's Dr. James. Let's attack the bar. Here we go. Ooh. Come on, narrow grip today, narrow grip. Okay, big lift, 3, 2, 1. Yep. 2. Good. 3. Yep. One more. Yep. Nice one, nice one, nice one. Yes. I did say 3, didn't I? Did I? It's my fault. I said 3.
That's all right.
And then I realised I had more in the tank. So let's go. I want to go for 4 to 5. 4 to 5, because it'll get the triceps cooking. It's my fault. Yeah, he's done. Yeah, it's my fault. I was just thinking, I've got more in me. I've got more. Right, awesome. Thank you, Tom. Splendid. Nice one, mate. Right, welcome back. We are back. It is Tuesday, Live Lifts. Yes, we love this. Right, so welcome back to live streams. We are smashing it. And we're now month 6, month 7. We're doing really well. The progress has been amazing. So welcome to all the new subscribers. Welcome to all the new viewers. Welcome to all the people who are viewing because you've caught one of my shorts as well. I quite a little clips of the live streams, and there are some interesting parts. Well, there's a lot of interesting parts in my opinion, but I put one out yesterday and it did really well, and I'm talking sense on this channel where we lift and we learn. We put the science into strength, backed up by research and the evidence base. You know, I'm a doctor, I'm an academic doctor, so I love research and I love treating patients, and I love medicine, I love science, I love surgery, I love everything. So it's all good. And I love training. You may not have picked up on that, but I absolutely love training and I love getting stronger, I love keeping fit. So as we do, we get into it, we attack the bar. What are we doing today? We are doing, as promised, narrow grip bench press. Heavy, so it's a new record again. It's a new season's best. We're doing 110. I've never done 110 before. I don't think I've ever done 110 on the narrow grip, but this is certainly a new record for this season as well. And good night, Chris. See you soon, mate. So we're smashing it every single live stream now for at least last 3 weeks. Every single live stream, I've hit a new PR every single stream. And what I'm saying to you is, you should be, if you followed the live streams and you've worked so hard after 5-6 months doing strength work, you should be in a similar position. It doesn't mean you're lifting the same amount of weight, and I honestly don't emphasize how much weight to lift. I emphasize technique and consistency, and you should be hitting new goals pretty much every session, whether that's new reps, new sets, new PRs, new PBs. And I'm certainly at that point now after my 6 months into it, so I'm really happy with the progress. We're going to do the set and then we'll talk about how we feel after the last session. And also, just to let you know, you may be wondering why I've got a massive heart on my chest. And of course, this is because this is March for Men. These streams are now prostate cancer awareness streams, because March is prostate cancer month. And I'll be discussing some basics around prostate cancer and getting checked and tested and supporting Prostate Cancer UK. I don't get any incentives for doing it. I'm not sponsored or incentivized in any way for them. I'm just doing it because I think it's a really, really, really good cause, and I use this stream for fun, to be trained properly with the evidence base, but I also use it to, I wanted it to help other causes as well, really. And I think the research they do is absolutely splendid. So go on the website and buy the merch. It's really good. It's really good quality. Like, these t-shirts are actually really good to train in as well, because they're not like, do you remember like the old Fruit of the Loom boxy heavy t-shirts that are too baggy? They're not like that anymore. They're really well manufactured. They're really well cut. And they're lightweight, but they've got enough weight in them to be strong enough. So They are very nice. I do recommend them. And support Prostate Cancer UK. Can we do another set? Nice one, mate. 4 to 5, 4 to 5. Definitely. I should tell Tom how many reps I'm doing. I shouldn't say 3 and then do 5, should I? So, so we'll talk more about prostate cancer in a moment. Right. Right, 4 to 5, okay. 3, 2, 1, big lift. Yep. 1, 2, 3. Let's go. Come on. One more. Yeah, baby. Woo! Smashing it, man. That's so good. Ah. Oh, fantastic. Thank you, mate. Oh, that's so good. Ah. So, what are we doing today? We're doing heavy, well, it's narrow grip bench essentially. So we're doing narrow grip bench, and then we're going to do some chin-ups. Because we've been loading up the back quite a lot recently, doing a lot of heavy squats. We've been doing a lot of leg work with the deadlifts as well. And we haven't done chin-ups for a while, so it's a new stimulation. It's a nice bit of variety, takes a bit of pressure off the lower back and the legs. And we did a really heavy session last time with these clean and jerk and the squats and the deadlift, and it was intense. So we're gonna do some chin-ups, and I'm gonna try 32.5 kilos on the belt. So that'll be another new record. And we are then gonna do bicep curls or curl and press for the shoulders, which will hit biceps and shoulders. I'm not sure yet, we'll do one or the other, probably gonna be bicep curls. So that'll be really good. A simple, clean, tidy stream where the exercises are not at all overcomplicated. Anybody can do them. Your basic squat, deadlift, bench, press, carry, and everything in between, a bit of supplementary work. So I've thoroughly warmed up. I cannot, and I do emphasize a lot during all my streams, I cannot emphasize enough how important the warm-up is as well. So make sure you are thoroughly warm. Right. We'll talk more about some of the bits and bobs in a moment. I just need to recover. Just need to have a bit of a stretch. Just stretches out the lats and pecs. So we probably do one more set, maybe 2 on this bench. Narrow grip, hit the triceps, hit the shoulders. Really complementary to the previous streams. So thank you for joining. Thumbs up on the video. Thank you very much. And we, at the time of recording this, we've hit 100 subscribers, maybe gone over 100 subscribers now. So it's fantastic. Train properly, do things properly over here. And I have absolutely ballooned in the last 4 or 5 weeks. My body has just gone pop, 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 pop in all directions. So very happy with the progress. How do I feel after the last session? As we always do, recap. Well, what did we do first of all? We've had 72 hours rest, haven't we? So we did lighter squats on 145, front squats, and then we did clean and jerk. And I felt absolutely magnificent. Yeah, it was a really, really, really hard session, but again, I just don't get any muscle soreness, and and I still grow and get bigger and stronger. So it's about stimulation and getting the right techniques. Awesome. Right, let's grab Tom, get another one going. Good set. Is that all right? Do you need a second? Are you recovering as well? Yeah, you recover, mate. Yeah, that's important. Yeah. Recover it. Vital. Whew. I'm wearing this belt because I'm going to do chin-ups. It's just props at the minute. We'll lose the belt. Just bash your ankles with the chain. They're really hard. That's good. They're really hard.
I know, I'm trying to build it back up. I'm squatting ages. I'm just going to do repetitions at 100 rather than...
Get the reps out, mate. Yeah.
Just get the muscle pack into it.
Work through the reps, mate. Best way. Absolute best way. Talk to my reps. You pull funny faces. Right. I don't know how many. I've lost myself at this point.
Fine.
But I'm thinking we'll aim for 4 to 5, but it's the third set, so we'll see what we can squeeze out.
Yeah. Yeah, it's got it, man.
Big drive. Right, 1, 2. Big squeeze. Okay, 3, 2, 1. Yes. 1, 2, 3.
Good. 5 here, come on.
5, come on.
Push, come on.
Yep, your bar. Sorry, mate. Awesome. Well done, fantastic. No problem, mate. That's sound.
Up to the face then.
No, mate, that happens, mate. You got to do what you got to do.
You're dying.
Nice one, mate. Are you all right? Do you feel all right pulling it?
No,
Fine. Yeah, it's a tough one. The triceps are very tough sometimes. Like you can have all the power, and then suddenly,
I know.
They just cut out. Gone.
But you've got to go flat neck, no.
Yeah.
In my opinion.
Yeah. So what's that? Third set.
Third set for reps, yeah.
Nice one, mate. That's enough. Appreciate that, mate. That's all you need. That's all you need. That's 3 sets. So what did I do, Tom? I did 5, then 6, and then 4, then 4, 5, 6, 4. Sound that, mate. So 3 by 5. I'm happy with that. Especially at month 6, that's a new record. And we're getting reps out on 110 on the narrow grip. That's absolutely unbelievable. Repping it out, baby. Happy. Somebody asked me today, actually, one of the other guys that trains here, Todd, who has been on another live stream, he spotted me a while back. I'd not seen him for a while, and he did say to me, how's your training going, how's it going? And I said, do you know what, I'm happy. Like, for this stage of the season, given how much I've grown and the form is good, the recovery is good, the body feels fantastic. I'm hitting targets. I'm not plateaued. I'm not bored. I look forward to it. So that's what it's about, really. You have to keep having fun. Meanwhile, we need to go up to 32. We're going to 32 and a half, aren't we? It's going to be another record. Another record. I do like breaking records on this channel. Not world records, of course. But mind you, natural world records, we don't know what they are, do we? Is there such thing as a natural world record? Interesting. Break my own records. It doesn't really matter, like, because if you go in competition or not, it's you against the bar anyway. It's you against you anyway. Unless, of course, you're going for like a team competition. That's really fantastic. Love that. We'll get a box, not a bench. The reason why is because when you're loaded up with this weight belt on you, around your waist, and you've got weight on the chain and you're stepping down, that's the point where you get a knee injury. You twist your knee, load it up, because you're putting an abnormal amount of weight through one leg as you step down. Or you tear your quad. So that's why you've got to be ultra careful, and those benches are a bit thin at the best of times. So if you get a bit of a head rush and you're a bit dizzy after doing your set, you might think you're stepping down okay, but you're not. So, bigger surface. Right, let's get this smashed out, come on. So we're doing peaking now, so we've lowered our reps as well. Let's see what we can manage. Yeah, that's great. Feels good, feels good. Let's see what we can do. Let's get the abs working as well. Oof. 3 reps, mate. Beautiful, gorgeous, smooth, good technique. Sound awesome. That's fantastic. 3 reps, charged up. Ooh. Oh. Oh. Give me a moment. Quick sip. Going.
Yeah, well,
Thanks, mate. Appreciate it. Thank you, mate.
Good.
Yeah, well done. You're doing well. Considering you're up that early as well. Doing well. Yeah. Keep going. Just 3 times a week, you said, yeah? Yeah, that's all you need. Yeah, you will get stronger as well.
Exactly.
Will you do more conditioning in the summer?
I say I will. I want to, and I should, but it's time.
Time. It takes the energy as well. It takes the energy. Yeah.
Exactly.
It takes the energy. Yeah.
Seat a little bit cleaner might relaxer.
Sound. Thanks for helping us, mate. Cheers. Awesome. Yeah, it's hard. When you're doing the conditioning work in the summer and you're working as well, you're up mad early. It's hard. So, welcome back. This is March for Men. We are doing prostate cancer awareness streams. So, buy the merch. This is from Prostate Cancer UK. I got a couple of them. I wore the white one in the previous stream, and I got this black one as well. So do pick one up. If you want to donate money to Prostate Cancer UK, they do some absolutely fantastic research, particularly if you know somebody who's been affected by prostate cancer. You probably have a brother or an uncle or a dad or a granddad who has been affected by it. And if you're not willing to donate cash, buy the merch. They've got some fantastic merch. You don't have to buy t-shirts. You can buy pins and rain jackets and mugs and magnets and things like that as well. Socks, scarves, hats, great. So get yourself some merch and do your bit. And there's lots as well. There's lots and lots of activities in terms of they're doing a cycle coming up as well in a couple of months. Cycling a certain distance. They've got hikes and there's general meetups as well. So do take part, and if you can donate something or in some way contribute, they do good work. They have really come on leaps and bounds, and I think the next step, from what I can read between the lines of looking at their website and looking at the research that they do, My understanding as a doctor and as an academic as well, what they're trying to do as well is find a more specific diagnostic test that's much more reliable and repeatable and accurate, and to essentially get a nationwide screening program for men of a certain age, perhaps, or men at risk. And once we find a test that's suitable and reliable and accurate enough to be able to reliably screen and pick up, you know, ideally 100% of the cases and rule out 100% of the cases that are not, that would be the ideal case, because the only cancers we currently screen for at the time of recording this in the UK is cervical, so ladies' vaginal type cancers, breast, colon cancer, bowel cancer, and lung cancer as well, because these, similar to prostate, if they're caught early, they can be very much curable. So that's what the indication I get from where their research is heading that they want to achieve, and they've done amazing things so far. And I'll talk to you more about it, but I'm going to do the set. If you can, give a bit, guys, and get them to donate. Ideally, if I had more subscribers, of course, I'm not fishing for that, but I could have a donate button on this channel and do more good, you know, causes to raise stuff, but I can't do that at the minute because you get a donate button when you got a certain number of subscribers, whatever. But all I can do is spread the message another way, and if you can get yourself to buy some merch or donate, particularly if you know someone who's been affected by it. I certainly do. I certainly know someone who's been affected by it, and it's a real silent killer, man. Prostate's just, the times you start getting symptoms and stuff, it's like, you've got to be lucky, man. It's like, most of them are picked up quite late. You start getting hip or back pain or blood in the urine or something like that, you know? So, thanks for joining in. Just get on the box. Come on, let's get some reps out. Very happy. That's really good. Because I'm about 100 kilos now, so I've gone from 92 kilos, 93 kilos at the start of the season, September time, to over 100 kilo. I'm at 101 kilo now, so that's like, I put on like 1 kilo, that means I put 1 kilo of muscle on every month. That's a lot, that's pretty good. In fact, that's amazing. You can put 1 kilo of muscle on a month. That's 6 kilos of muscle. So that's 5. That's a lot of muscle. That's 5 kilos, that's 5 months equivalent. So I wonder next month when we've done 7.5, if I would have put on 7.5 kilos. That's a lot of lean tissue. That's 7.5 kilos of mass. That's a lot. No wonder I've gone up a few dress sizes. That's the biggest problem that you have. It's like my clothes gonna fit me anymore. I swear, like, I'm kind of like weirdly between sizes as well. I don't know if I'm a large or an extra large at the minute. And there's some things I'm an extra large and other things I'm a large. And then you get some like oversized fit stuff and I'm like, oh my God, I'm a medium. Or a large, I don't know, it's weird. So anyway, let's get back to the prostate cancer chit chat. I mentioned some bits in the last live stream. I will keep recapping it because different people catch this at different times, and I do think the message is a strong one. 12,000 people die every year. These are stats taken from the Prostate Cancer UK website. 12,000 people die. It can be less. It can be less, and it can be less because we've got to catch it early. And signs and symptoms can be quite vague. That's the problem. We used to do something called a prostate exam, and that's literally a finger up the bum. We still do it nowadays if people someone's got bleeding from the back passage, or they've got, you know, a hemorrhoid or something that's irritating the area, or an abscess around the bum or something like that. So what we're feeling for when usually the GP will do a finger test at the bum and they do a little sweep around your bum canal. He's looking for big lumps and bumps on the prostate, and it's quite rudimentary really, it's quite indiscriminate. It's going to feel something that's really, really obvious if there is one, but the prostate can get bigger and get a bit lumpy anyway as we get old, so how accurate is it? And just because you've got a lumpy, bumpy, large prostate, it doesn't necessarily mean that it's cancerous. Sometimes it can just be big and lumpy and bumpy because you've had some hyperplasia. It's just grown with age, and as the prostate grows with age, it releases more of the hormone that it produces, this little protein called PSA, prostate-specific antigen. Now, there's different types of PSA. If you look at a biochemical level, there's free and there's bind, and then it breaks down into an inactive form. But I won't go into that. But I'm just trying to get the basic message across, really. So they detect this level of PSA in your blood, and so we've gone from finger testing to doing a blood test. And what they used to do previously was do a finger test, and then they send you for a biopsy, which is a sample of the tissue. But again, it's quite inaccurate, because if you're going to take a tissue sample, you've got to know exactly where you're going. If you want to check if it's an area of cancer, you need to take it. So it's kind of like let's say you're a plasterer or a builder, and you've got a leak on the wall, and someone says, "Oh, I've got a leak on the wall there," and you want to take a sample of the plaster on the wall and to see if it's damp. The problem is, if you take a sample of the plaster where it's from a dry area where there's no leak, then you'll think that you haven't got a leak. Do you know what I mean? So you have to be quite accurate in where you're taking that sample of the wall from to check if the leak is true, and obviously you'll have other sensors, you'll see the water dripping through. No. So that's just an example I'm trying to make. So essentially it's the same thing when they go in trying to take a biopsy of the prostate. You've got to get the area that is suspicious and cancerous, or potentially cancerous. So again, taking a biopsy has its uses, but it's what they found from the research is it's of course better to combine doing a biopsy with some imaging. So you'll probably be referred by your health professional for an MRI. They do quite a specific type of MRI. An MRI just essentially looks at fluids. It looks at water in the body in black and white, and different tissues and organs have different levels of fluid, so they show up as slightly different colours in black and white. So we can guide the biopsies under an MRI imaging, so we give you more accurate to get a good tissue sample and see if we can combine that with signs and symptoms, with PSA level in the blood, finger findings, if you like, if these eggs are back passage, and the imaging on the MRI as well. See how everything looks together, and the expert that you'll be under, which will be the GP, or ideally the GP or the urologist or a specialist nurse, they'll be in a much better position to interpret the findings. So don't worry if you do have a raised blood level, because the PSA as a protein in the blood, it goes up by about 3% in normal people anyway every year, over 40, over 50 years old. So it increases by about, I think it's 3 grams or 3 nanograms a year. So there's different levels for your age as well. So it's quite an unreliable test. Based on your age, it will be high. And then it will also be higher in people who have had some inflammation in the prostate, or a recent exam, or something in the anal canal, a recent infection in the prostate can also push that blood marker up. So just because you've got a high blood marker, it doesn't always mean that you have a prostate cancer. But it's very wise to get checked, guys. Got to spread the word, because it can sneak up on you quite insidious. Right, let's do some more reps. Reps. Last set. Awesome. threes are good. Ah. Let's do some bicep curls. See if we can hit the biceps. I always do that, lopsided. Right, let's get some weight on the bar. Whew. We should be warm from the chin-ups. So we'll do one light set and then we'll get straight into the working set, because the chin-ups would have hit the biceps, and also the narrow grip bench would have warmed up the shoulders and the triceps, so they should be pumped and ready to go. But we'll just make extra certain. All right, let's do a set. I should bring you around first, shouldn't I? Just turn my back on you, sorry. Bring you over. Awesome, right, let me bring you this way. I think, yeah, somewhere like that. Beautiful. Right, you see me pulling funny faces now when we do the bicep curls. How about that? Righto, so today if you're just joining, this is Prostate Cancer Awareness Stream. So if you can't donate to the charity, do go and buy the merch because it's absolutely brilliant. And it was really cool as well. So it's March for Men, raising awareness of prostate cancer. And I think we talk a lot about men's mental health because there's a stigma, And I think just men's health in general, like men present very late because it's a kind of like, there's nothing wrong with me, I'll get on with it. We always kind of think that things are going to fix themselves, and then suddenly they don't. Suddenly, you've got a silent killer, which is a prostate, and it's spread, and then it's too late. The outcomes aren't as good. So if you can get to the GP or contact a specialist nurse on the Prostate Cancer UK website, or do you know what actually they've got, which is amazing? On the Prostate Cancer UK website, right, they've got a form that you can fill out, and you answer the questions on the form. It scores certain criteria, and it tells you what to do. So it makes it a bit easier. And just because you've got some signs and symptoms, it doesn't necessarily mean it's cancerous either. It can sometimes just mean that you've got a bit of a growing and large prostate, or it can sometimes mean that you've got a little bit of infection. But that'll need to be treated differently. And just because you've got some signs and symptoms, it doesn't always mean that you're going to need and have a biopsy. Some of the prostate conditions that they find, they watch and they wait because some prostate cancers are more aggressive than others. But of course, reach out to the experts, reach out to your specialist nurses. They've got fantastic contact on their website. Speak to your GP. And of course, do get checked if you're Black or African, 40 years old, or you're someone with a strong family history, such as a brother or a father, grandfather who's had a prostate cancer, or even there is some link that's suggested from the research that if you've actually got a sister, a first-degree relative, sister, mum, grandma, who's had breast cancer or ovarian cancer, there's some suggestion to say that on the male side of the family, they're a little bit more at risk of getting prostate cancer as well. So the ultimate thing is to catch it early. And don't be afraid, reach out. So I certainly would. So if you're 40 years old and black, or African American, or black British, whatever, or if you're 50 years old and Caucasian, or strong family history, or if you've got signs and symptoms, such as a little bit of blood in the urine, or if you're needing to go to the toilet a little bit more frequently, or you can't quite empty your bladder. Now, that could be a sign of an enlarged prostate as well. But sometimes if the cancer is growing a bit more centrally, because it's like a walnut, so if the cancer is on the outside of the walnut, it's not going to press on anything, it's just going to grow. But if the cancer is in the middle of the walnut, where this stream of urine passes through the middle, or ejaculation passes through the middle, if something is growing in the middle, it's going to press on the exit where the urine or the semen is flowing through. And that's where you're going to get some symptoms of like obstruction. But it doesn't necessarily mean it's cancerous. It could just be that you've got an enlarged prostate. And it's benign, something called benign, and benign is a fancy word for harmless. Yeah, we're well warmed up there. Let's get some weight on the bar. More weight. Light sweat, heavy weight. So that's some basics around prostate, and the main thing is to get checked. I had a family friend who left it too late, and do you know what actually, I'll tell you the story actually. I had a family friend, I won't identify who they are because that would be, of course, wrong and not confidential, but all I can say is a family friend who realised he was losing weight, had a little bit of vague back and hip pain, but you know, with age, probably just thought it was quite normal. You know, he's worked his whole life and probably thought, I've got a little bit of back pain, whatever, but lost a lot of weight. And then he went on holiday, went abroad, bumped into his brother on holiday, and his brother went, oh yeah, I've got this thing with my prostate, and it's quite bad. Turns out it was prostate cancer. So he says to him, you should get checked out because you're my brother. And he went, well, actually, do you know what? I've lost a lot of weight, you know, and I've got a little bit of back pain. And he did, and he went and got checked. And unfortunately, it was too late. But he'd had these symptoms for a while. So by then, you know, it spread too far, because the prostate will spread, you know, forward into the waterworks, into the penis. It can go out into the pelvic organs, out into the bones. It can go to the back, go to the rectum, go to the bladder. It can spread, of course, when it's too late, and there's very little you can do then. But of course, if you catch it early, you've got much more of a chance of having the prostate removed, which of course is the curative treatment if you catch it early. But of course, discuss the options with your healthcare provider, of course, because there are many options. But having the prostate removed, of course, in part or in whole, is not without its complications, you know. I'm missing a 10, so I'm going to use 2 5s. Sorry, it's going to go against my... Can I pinch a 10 over here? I will do. So discuss the options with your GP or your urologist. If you get referred to a urologist, I'll pinch this 10. I've got a thing about having the same weights on each side. So if you know someone who's been affected by prostate cancer, do reach out. There's a lot of help available. Or if you are currently affected by it, because you had a diagnosis recently, do you know what, guys? Speak to people. The practice nurses, what we've invested and trained in this country in terms of nursing staff and NHS staff, the specialist nurses are absolutely unbelievable. So reach out to those guys. They have got an absolute wealth of knowledge and they can help you. I think I need 2.5s on here. Go for 42. I'm tempted to go for 45, to be honest. 45 kilo curl, but let's see what we're doing on this 42 first. So buy the merch. go to Prostate Cancer UK. As I've mentioned, I don't get anything for it. I'm not sponsored or don't have any incentives, but you see, looks quite nice, doesn't it? I think so. Right. Oof. It's a bit heavy. See what we can do. No, wasn't happy with that last rep. I would say that was 5 reps. I can't count that last rep. Just making sure it's not in our way. Wow. Put this away. More chalk. Fantastic. 42 is enough. But considering we've done narrow grip bench and we've done chin-ups, very heavy chin-ups, 132 kilo chin-up, or 133 and a half kilo chin-up. Pretty proud of the biceps to be in action. Yes, that's going. Whew. Whew. So I read a lot actually. I've been reading a lot about prostate recently in order to obviously to prepare for these streams as well, and I think to share the message through my channel is just keeping it understandable really, because obviously there's medical understanding and lots of detailed tests and types of proteins and but it is quite interesting to read about. But I think for the purposes of accessible information, just really about making people more aware of it. But yeah, I've been reading a lot, man. Like, the PSA test is a blood test, basically. That's the main contentious issue, is the blood test, because the values are so somebody without prostate cancer can still have a high PSA blood test. So that's why it needs a specialist to interpret those results. And then, there's a lot of contentious and controversial discussion at the moment about, what's a good cutoff value, how specific is it, the test for finding it, how sensitive is it for detecting it amongst other conditions, can it distinguish between, an enlarged prostate that's producing more more protein, a gland that's enlarged and ultimately the cells are producing more of the PSA, or is it cancerous and it's spitting out a form of the protein that's been detected. That's why these guys are doing the research, and that's why it's important for you guys to donate. It is a good cause, and they do need the funding. There's lots of very positive academic research going on in the background that give us the answers and provide an evidence base for us to help detect things sooner and get people better treatments. And it helps our understanding and knowledge of things as well. Right, should we do another set? That's 5. I can't do any more than that. I can't do any more than that. Ah. We can do one more set though, and then we're done. Ah. Whew. Men's health. Well worth raising the awareness of. The irony of this 6 months of training is you come to the gym to get fitter and healthier and lose weight, but you end up then getting fitter and stronger, and then you put weight on. So you're back to the same size, but you're carrying more muscle, which is better, and it feels better as well. It's like, oh, you know, you want to drop a jean size or something like that, so you get fit, drop, and then your muscles start filling out, you're back up to a bigger size. Oof. Fantastico. We'll do one more set and then debrief. Oh. There's certainly a lot of the Afro-Caribbean community that came over in the 50s and 60s, especially to places like Liverpool, and that, you know, that generation and their descendants, their children and grandchildren, you know, we raise awareness of the prostate to those guys as well, because it's easy to slip through, isn't it, you know? Taking certain medications, I was reading as well today actually that taking certain medications can affect the PSA blood level. If you're on something that lowers your cholesterol, if you're taking ibuprofen or a non-steroidal anti-inflammatory, if you're taking something that's for an enlarged prostate like finasteride or I think it's called deutericide, I can never pronounce it, but it's a similar action to the finasteride, and it's to help shrink the prostate a little bit. Makes it, it's a receptor blocker essentially. 5-alpha, it's called 5-alpha reductase, and finasteride stops the enzyme from turning testosterone into dihydrotestosterone, and which is a bit more responsive to the prostate. It causes it to enlarge. So taking some of those medications can affect the level of your PSA as well. So as I said, you know, don't be afraid, guys. It's like, just because you've got a raised blood level or got some symptoms, it's not always going to be prostate cancer, but it is worth getting checked out so people can monitor you. And it helps to add the numbers and the data. Data is so important, and I was having a chat about this today with my manager, like quality of data and data collection. We need the quality and the detail, because the more people that come forward, we have more information about the condition, and it makes it easier for people to recognize patterns or find certain correlations and relationships between things. And then that's essentially, with good research and good techniques, that's how we can find cures and understand conditions better. Right, let's do the final set. I think we've talked about prostate enough today. I've done some good sets. So hopefully the message gets out there, and I'm just doing my bit. Right. Let's get these biceps going. Oof. Biceps are insane. Damn, I've gotten bigger. All right, thanks for joining the stream, guys. It is undoubtedly appreciated. Whew. Let's do a quick debrief. And I finally got more bananas. I've not had a banana for a while. There's no bananas left in the country. I've eaten them all. Right, let's debrief, of course. Got the banana, yes. Not had a banana for a while. I bought loads. I bought like 3 bags. Or 3 bunches, whatever you want to call it. Come in bags now, don't they? Ambitiously bought loads. And then like the 3rd bag started going off. So I had to eat loads in there quick because they get moldy. Yes. Great way to finish an amazing session. It went really fast, didn't it? And that's the thing now, right? So, this stage of the season, depending on the exercise and the warm-up and so on, and the complexity of the exercise and the recovery, because if you're doing sled pull or something, or farmer's carry, like the recovery is a bit different because it's a bit more like conditioning aerobic stuff. But if you're doing like chins like today, and narrow grip bench, you're doing 4 or 5 reps, you're doing 3 sets, you know, you've got shorter sessions, and essentially you should be doing that at like month 5 to 6 because you've been grinding it, well not grinding, but you've been like hitting heavy sessions at like 90-minute, 2-hour sessions for like 5 or 6 months. By the time you come to month 6 and 7, you should essentially be having shorter sessions because you should be, the strain is higher, but for a shorter period of time. It follows the principle. So what do we do today? Prostate cancer awareness. Get your merch. Get your merch. Or if not, don't buy the merch, donate some cash. Do a run, do a cycle. There's lots of charity events on their website. Absolutely fantastic, get involved. Get screened, get tested, go to your GP or your local service provider. I'm not here to offer medical advice. Don't contact me about that, don't reach out about that. I'm just doing my bit to raise awareness for you. And of course, if you do need help, you do want to talk about it, lots of people available to have a chat with, contact the specialist nurses and helplines they've got available. If you are, or you know someone who is affected by it, fantastic, this country, the UK, lots of health and services available, so use them, yeah. Right, so we spoke prostate cancer. We did heavy, new record, narrow grip bench press. We did 110 kilo on narrow grip. We hit 6 reps, 4 reps, 6 reps, 5 reps, 4 reps, something like that. Average of about 5. Pretty good to 3 sets. Then we did heavy chin-ups on a new record, again, 32.5 kilo. And then we did 42.5 kilo bicep curls on the barbell. So I'm happy about that, amazing. And hopefully we've raised awareness of prostate cancer a little bit more. Catch it early, curable. Potentially curable. Men, get yourself seen too. Don't leave it too late. Women are great at that. Like, if there's a problem, they go to the doctor and they get things seen too early. They're really known, like, traditionally as well, in like all of time, to be like better health keepers in a family. But the men take ages, don't they? We wait and we wait. We think it's going to be okay, and then go and get your MOT done, guys. I need a bin. Ah, beautiful, right. Satisfying. Fantastic session. Thanks for joining, amazing, as always. We'll be back in 2 days for more live lifts, more strength. See you soon, thanks for joining, see you later.